Earlier this week, Pfizer announced that its data shows 3 doses of its COVID vaccine appear to be safe and effective against the virus in very young kids. Here to answer your questions about that, Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Dr. Moffatt, always great to see you. We really appreciate you being here.
Sure. Yeah, good to see you too.
Yeah, thank you for being here. Obviously, this is big news. A lot of parents have been waiting for, but we should point out this is Pfizer's data. What are you taking away from this right now? Do you have any questions surrounding it?
Yeah, no, it's exactly as you said. So this is Pfizer's description of their own data. So it will be really helpful to see the actual data. We know that the FDA Advisory Committee now has a meeting set on June 15th to review data from this study. And the same day, they're going to be reviewing data from Moderna's trial of a 2-dose series in children under the age of 6. We also know that the full data are typically made available to the public right around the time of that meeting. So I think a lot of us are really looking forward to seeing the full data. My questions will be really to look at the safety effects, the side effects, the safety profiles, and the immune responses, and to really see how those compared to 5 to 11-year-olds and 12 to 15-year-olds in similar trials. So that's what I'll be looking at.
Doctor, what can you tell us about the process to make sure that the dosage is safe for the littlest kids?
Yeah, so that process actually started pretty early in the course of these trials, and it started by evaluating the dose that had been chosen and determined safe and effective in children just older than this. So that was the 10 microgram dose that's been authorized now for 5 to 11-year-olds. In a small number of 2 to 5-year-olds, they gave them that 10 microgram dose, and they gave them this smaller 3 microgram dose. And on balance, they found that the side effect profile was more favorable with the lower dose, and that was not at the cost of the immune response. So there was still a good immune response. So that is why the 3 microgram dose was chosen, and they've continued to very carefully evaluate for any safety concerns or side effects with the 3 microgram dose in a larger number of children under 5.
Okay, and we know this weekend is kind of the unofficial kickoff to summer here, and a lot of kids going to summer camp, going to be doing a lot of activities. What should parents keep in mind to make sure their kids are as protected as possible?
Yeah, I think we've all been so focused on COVID-19 vaccines. When are they going to be available? I think as a parent, I would just take a step back and think, am I caught up on all of the non-COVID-19 related health things for my kids? We know that a lot of routine immunizations and a lot of regular pediatric health maintenance was missed or put off during the pandemic. So I would think about whether or not your child has had a visit with their pediatrician in the last year. Are they up to date on their routine immunizations too? And make sure to schedule those visits if indeed they've fallen behind at all. The other thing I'd be thinking about as a parent is, how is my kid going to be spending their time to keep busy this summer? The camps or the programs that I'm thinking about, can I take advantage of as many outdoor opportunities, camps, and community programs as possible? Because we know those are safer settings in terms of really any respiratory virus having decreased transmission likelihood in outdoor settings.
Dr. Moffatt, thank you so much. Have a wonderful weekend, and we always appreciate your time. Thank you, Doctor.
Thank you.
Sure, good to see you.